One of the biggest health inequalities is that if you are on the serious mental illness register, you're more likely to die 15 to 20 years earlier than the general population. That's a shocking statistic. But just imagine if that was you. Imagine if that was your loved one, your partner, your child. But the real kicker is this, that 2/3 of those deaths are potentially preventable.
Because a lot of these deaths are down to cancer, and by detecting cancer earlier we can prevent some of these deaths, and one of the ways of doing that is through screening. So we're going to show a conversation between some people with lived experience of severe mental illness and service providers to look at some of the ways that they can work together to make these statistics better.
I'm thinking about those statistics. How long have I actually got left? You know what I mean? Unless if it's preventable as well, how long have I actually got left before I start to get severely poorly? I mean, it does make you think about these things, you know, because my partner, she's got learning disabilities and she's got health and anxiety issues, and she's got health anxiety. So actually getting her to go to a screening is really difficult. To go any cancer screening or anything is really difficult because of her health anxiety. And she could be a person who could be falling into that bracket as well, you know what I mean? Because she's not getting seen, basically, you know what I mean? So
we need to, be making sure we're making those adjustments for your partner and for everybody else in terms of, making it feel that little bit less daunting than what it is, because I'm just, it is very daunting anyway, isn't it? So, but for someone with health anxiety, it's going to be really, really triggering receiving that letter or getting that message saying you need to come down for this appointment. And although it offered routinely, it can be really triggering.
Is there a thing as well about actually the way it's offered? Do you know what I mean? The actual way it's actually offered, and rather than having a text or a letter, actually having that contact and being in contact with the person and changing the whole ethos of how it's actually done. You know what I mean?
If you're looking at it from a personalised approach, so it's more holistic, it's not that one size fits all. It's what matters to you. Yeah. How do you want to be communicated? How do you need that communication? Is it by letter? Is it by text? Is it by phone call?
So from our perspective, we know what we want, but I was just wondering if you have anything in place. What do you actually ask the people, with SMI, what they want, and do you have anything in place already?
We've been doing that pilot around the SMI and the reasonable adjustments and the letters that have been going out. So what we've tried to do is carry that into everything else. So it is looking at those reasonable adjustments. It is looking at if we can get the about me on the system for that patient. So how do they want to be communicated? Do they need longer appointments, with the GP or the nurse? Do they want to be seen in the community? Do they want to come into the practice? Do they want to home visit? Is it a telephone call? So it's all having those reasonable adjustments to be able to then communicate.
So it's important for us as healthcare professionals to see each individual need and to explore the barriers that there may be and to do our best to make reasonable adjustments to overcome those barriers.
A reasonable adjustment could save a life, and it's really important that as professionals we think about that and change our mindset. So when that screening letter drops through a letterbox, or that bowel screening test, people might not understand what it is. They might be anxious and they might be fearful.
So it's important that we give them the information as clearly as we can about what screening is about what the test itself involves, and what their expectations can be about when to get the results and things like that.
The fear is the word cancer, and that's the big issue. As soon as that's mentioned and it's any kind of screening, I'm like straight away, oh my God, I've got it. Do they want me to go for it because I've got it?
I think knowledge is really good in it about how the whole process works. Most of us suffer quite badly with anxiety, But if we know what's going on, so we know exactly what's going to be happening at the appointment when you're having the screening, or the kit, how to use it and all that. But it's not just that, it's moving on beyond that. How long does it take for the whole process of sending it to the labs, how long it takes there, what happens when it comes back to the practice. And it's those timings, because we think we've sent it off, we've had the screening, a couple of weeks, we should be hearing back. And if we don't know, then there's more and more anxiety going on, which is then having a knock-on effect with our mental health.
That's partly our responsibility, wholly our responsibility, to make sure you're aware of the process.
Yeah.
And I've had a lady, for a cervical smear, who's been too anxious to come to the appointment, but has come for something else. And I've picked up on it, and so I've shown her the equipment and talked her through the process of how long after she'll get a letter, and told her she can bring someone with her and they can sit with her and hold her hand if she wants. I think we've just got to be open and give that patient as much information as they need.
Can people visit the breast screening unit before their appointment?
They can, yeah. There's a phone number in the breast screening invitation letter that people can ring to ask to visit the unit before they have their screening appointment, and the breast screening service will show them round and do it in stages if needs be, to make that as accessible as possible for people. So it's important, isn't it, that we as service providers understand some of the barriers and difficulties that people with SMI may have in coming to screening and accessing screening.
Definitely, and I think it's really important that we don't make assumptions that someone else has had that conversation with people.
It's important that we all play our own part and make every contact count.
Before I had all these issues before, it would have been a massive thing for me to be able to just, am I doing it right? Am I doing it properly? Am I going to get germs from it? All that kind of stuff about the raw material, basically. I just don't want to be going near it, and how do I minimise that?
I think it's doing the awareness events. So it's having your staff that are going to go out to public arenas, so it could be in your GP practice, and having the kits there, so they're all opened up and showing. It might be having like a bit Nutella.
Yes.
Have a go at it, mate. Let's make it fun. We do the information events, and we've got the knitted, for example, we've got a knitted bowel. Right. We've got a knitted cervix, and the knitted little figurines that having the like a colonoscopy, or they're there having the screen, the cervical screen. We've done sort to try and build that engagement between the practices and the patients, do cervical drop-ins.
I think no appointment would be a wasted appointment, even if it is sitting down and having a conversation and, like you say, looking at the equipment. That's not a wasted appointment, because that has helped you have a better understanding, hopefully feel a little bit more reassured, build some more of a relationship and rapport, to then hopefully make you feel that little bit more comfortable the next time round. And if not, we keep going and we just keep building on that.
We should be asking, and we should be asking to make sure that people know how to examine the breast properly. Start the amount of people that I've seen that when I say, do you examine your breast? Oh yeah. How do you know how to do it? Well, not really. And they've never really been shown how to do a proper examination of the breast. I think there are things that we can do. And you mentioned before about seeing somebody for an asthma review and noticing. I think we do have to get better at making every contact count, as I say.
The way we speak, the language we use, the time we take is really important.
Because if someone has a bad experience, that could put them off accessing a healthcare appointment, or any appointment actually, whereas a good experience is more likely to encourage them and make that access so much easier.
And that compassionate approach could save a life.
A good thing that we're here as we've got people like with us with severe mental illness, you've got your other professionals, but it affects us all, doesn't it?
Yeah.
Our partners, our families, our friends, you know, and I think just by able to have this kind, compassionate approach is what you've got and is what we're looking for, because traditionally, like my experiences with health professionals with my mental health have been some kind of daunting. Some of that is like my inner language and my mental illness telling me that I'm not safe.
I personally got with experiences with cancer, and I've used that when I'm speaking to other people. So the job as a social prescriber and the previous role, being there as the patient and then being there as the health professional, and that explaining, you've been to your doctor, this next stage, were you as that individual going, why is it taking 2 weeks, why is it taking 3 weeks, why is it taking a month? But being that healthcare professional and seeing it on the other side was like, you know, sitting in and seeing the NDTs, like you've got everybody around the table, and you know the hospital, your oncologist and everything, and actually seeing that, and then suddenly going, right, so then that's given me that knowledge and skills to be able to talk to somebody and say, this is why.
So when I ring my GP, the receptionist at my GP, they're really lovely, and they'll be like, oh, hi Karen, how can I help you? And that kindness of somebody, it's not, tell me what you want to see the doctor about. You need to tell, you know, there's none of that, I don't feel like I'm being treated badly. And I love how they'll say, the only reason I need to know what's wrong or what you're coming to see the GP about is so I can direct you to the right healthcare professional. Because
I think when you're actually in appointments, for myself, it's all about you, isn't it?
Yeah.
And there's a barrier between you and the health profession. So if you know that you can actually talk to us on a level of that understanding of that anxiety, it breaks down that barrier between us.
So this film is just the start of the conversation that we should be having with each other around cancer screening.
Because people on the SMI register have the right to live as long as everybody else.
If you do need any more information, you can visit the Pennine GP Alliance website, where you'll find loads of information and videos and resources.
Thanks to everybody who's contributed. Please share the film and continue those conversations.